Thank you, Mr. Speaker. Question number 2.
Minister.
Thank you, Mr. Speaker. With permission, I will answer questions 2 and 3 together. We are taking the findings of PHE's COVID-19 Review of Disparities in Risks and Outcomes report, which was published on 2nd of June, very seriously. The next steps are to fill the gaps in the report which necessarily had some limitations. The Race Disparity Unit and the Department for Health and Social Care are working with me to do this, and this vital work will help us take appropriate evidence-based action to address the disparities highlighted.
Thank you. So given the delays between publishing the report, publishing the recommendations and the likely delay now in implementing those recommendations, how does the government propose to rebuild trust and confidence in the government's actions with BAME groups and individuals?
Minister.
I believe the Honourable Lady is conflating 2 different reports. There was no delay in publishing the first report, which did not have recommendations. The second report was published by PHE just yesterday, and many of the recommendations are already in train. But I refer her to the written ministerial statement I laid yesterday, which hopefully should provide additional clarity on that.
Dr. Curran-Mullen.
Thank you, Mr. Speaker. And if I may, I want to begin by paying tribute to the very many BME staff I've worked alongside in the NHS, including in recent months. They're an absolutely vital part of the NHS team, which is why it's really important that we get this review right, and it's crucial that we get the necessary expert advice to help us do that. Can the Minister inform the House of the steps she's taken to get that expertise to support the work she's undertaking?
Minister.
I do agree with my honourable friend. We are determined to proceed with this in an evidence-led way, and we will be engaging with experts in the field. On Friday, the Minister for Public Health and I held a virtual roundtable on these issues with a number of public health consultants and leading academics in this field, including Professor Michael Marmot. I'm very grateful for their input, and we intend to continue in this spirit by engaging with other experts, such as the ONS.
We now go to Shadow Minister Marcia de Cordova. Marcia.
Thank you, Mr. Speaker. Professor Fenton's report, finally published yesterday, highlights yet more evidence that socio-economic inequalities, racism and discrimination are root causes to BAME communities being disproportionately harmed by COVID-19, and that these injustices were already known and has already cost lives. The government's denial and delay further compounds despair at their lack of care and concern. The 7 practical recommendations the government should have taken much sooner include risk assessing our Black and minority ethnic workers on the front line. Black Lives Matter is more than just a slogan. So what immediate and decisive action will the Minister take now to develop and deliver culturally competent occupational risk assessment tools?
Minister.
Mr. Speaker, I refer again to the ministerial statement which was laid yesterday, which does cover this. The government did not delay publishing any reports, and recommendations which were published, most of which the actions are already in train, can be seen on the gov.uk website.